Well, we want to touch upon one really interesting thing of what's occurring, and that's the Wills Glaucoma App, and some of the things that have yet to come, the exciting world ahead of us. A lot of what we saw today is new. Certainly over the 12 years we've been doing these conferences, there's been so many advancements and changes, and we're going to talk about one more.
All right, well, good morning, everyone. I want to thank Dr. Daniel Lee, Rita Stern, the Glaucoma Service Foundation, all the volunteers here again for organizing a great event. It's very obvious that this is a great way to learn more about glaucoma, the really new and up-and-coming technologies, drugs, devices. But I wanted to take a step back and just talk a little bit more about the barriers that glaucoma patients do encounter, and kind of just some of the resources that are available to glaucoma patients and their families. There we go. All right. So just a quick outline of what we'll be discussing briefly today. So starting with the Wills Glaucoma App. How many of you know that this Wills Glaucoma App is available in the App Store? Anybody here? Yeah. So, so if you have a smartphone or if you have a device that has an app store, I do really encourage you to download this application. It's free, and it's really a lot of time and resources from a lot of the people that you've heard of today have really gone into this. And I just want to briefly go over how it could help you in a day-to-day way. So here first, there's a section called About Glaucoma, and there's some great videos here from some familiar faces about what is glaucoma, how is it diagnosed, who gets it, and I really encourage you to take a look at these videos. It'll probably have some of the similar information that you might know of or have heard of today, but you might learn something new. I also think it's a great way for you to share your disease with family members who might want to learn more, and as previous speakers have mentioned, glaucoma does run in the family, and so your first-degree relatives, especially your siblings, your parents, or children, they are at increased risk for glaucoma, and it's really up to us as providers, but also you as the glaucoma patients to educate your family, and so this is a great way to share something with them from reliable sources. There's another section about eye drops, and there's some great videos about how to use eye drops, the various side effects you might encounter, and the different types of glaucoma medications. There's also videos about lasers that you may have already had or may be talked about in the future. And there's a section about surgeries, mostly the common ones we've discussed today, trabeculectomy, tube shunts, and lasers and cataract surgery, and some of the MIGS devices as well. There's also a section about the visual fields. So many of you have probably taken these, but I know they can be frustrating, but there are always some great tips that you can hear about to make it maybe a little bit less frustrating or to get a more reliable exam. So again, that's a great video to take a look at. I think my favorite section, though, looking at this app is probably the My Pressures tab. And this really puts a lot of control in your hand. So feel free when you're in the office to really ask us, what's my eye pressure today? And you can record your right eye, left eye very easily. And then afterwards, you can formulate this into a list, or you can even look at it as a graph. And feel free to ask us questions when you're in the office about these trends. And again, in the future, maybe if we have 24-hour monitoring, or if you're taking a look at these pressures at home, this would be a great way to keep track. Again, I know a lot of people travel or in different places over the year. This way you have your medical records in your hand, and you can share that with different doctors without waiting for that fax of medical records, which can sometimes be frustrating. There's also a tab called My History. Again, you can record your allergies here. So I know sometimes it's hard to remember which drops you've been on in the past. So I encourage you to write down the medications that you've been on, and if you've had, whether it's an allergy or bad side effect from it, and that way, again, if you're shifting doctors or have moved or seeing someone in an emergency, that information is available to you. There's also a section called My Drops, and there's preloaded glaucoma medications and other eye medications here. And what I like is that there's also the colors of the bottle caps here, just as a refresher. So you can add this again to the app and keep track of which medications you're on. And if you can't find your medication here, you can also add it as well. And I tried this myself, so if you add a medication, you can also set certain times that you want to be reminded to take that medication. And I know it's really, it's hard for me to take a vitamin every day. I can only imagine it's hard to take an eye drop 3 times a day. So I think every little bit, if you think it's helpful, even though it takes an extra few minutes to set this up, would be really great. And in the top right corner, where the calendar icon is, you can also add appointments and set reminders. Again, just one less thing to remember. So again, I encourage you to download this application. It is free. I double checked and there were no issues downloading it again last night. But if you do have any issues, feel free to let us know. And of course, if you have any suggestions for what else we could put on the app, we're always happy to hear about it, and we'd always love to improve. And this is just a list of all the people that were involved in putting this app together for you, and it's really designed for the patients. So moving on, we know that eye drops can really be a struggle to get in. So I know it sounds pretty simple, but I just wanted to go over some basics here, just to make sure we're all on the same page. There's many different ways to put in eye drops, but this is just one of them. Again, I encourage you to just keep everything clean when you're dealing with the eyes. So wash your hands, keep the bottle caps on the bottle, try to keep all of these things very clean. But after that, again, a very important part of getting your eye drops in is really to tilt your head as far back as you can to try to avoid missing. And then one easy way is to pull down your lower eyelid with your index finger and then tilt your head back and then put in one drop. After you get the eye drop in, one quick thing is I know people mention that sometimes the drops run down their cheek. And as long as you felt that some part of that eye drop has gotten in, you do not need to put another eye drop in. You actually don't need that whole volume of an eye drop. You need less than 1/5 of that. So that's just one other tip. When you're done putting in your eye drop, one thing that we would recommend, if possible, is what we call punctal occlusion. So that means taking your 2 index fingers and just putting gentle pressure right here. And we'd encourage that for about 30 seconds to 1 minute. And that does a few things. So it will decrease the likelihood of the drops going into the rest of your body, into your bloodstream. And that does 2 important things. Number one, you're less likely to have side effects in the rest of your body. So, if you're using something like a beta blocker, something that might affect your heart rate or might affect your breathing, then it's great to use this. And number 2, it's more likely to give the eye drop more time to be absorbed in your eye. And then, of course, carefully blot away any excess drops, because drops that are sticking around on your eye are what give you kind of that redness on your eyelids. Tip number 2, again, something very simple, but is to space out your eye drops at least 5 minutes apart. So again, if you're using 3 different medications in the morning, if you're starting at 8 o'clock in the morning, you should only use it at 8 a.m., 8:05, and then 8:10. Or some people like to space it out even more, but that way you're not washing one eye drop out with the other. Tip number 3, something I've learned from you guys, from patients. I mean, everyone has their creative way of dealing with the burden of getting these drops in. And one of those things, I think, is to really relabel your drop bottles. So you don't want to cover up everything to a point where you don't really know what you're using, but the font size is pretty small. And oftentimes you can't really tell the difference between the different bottles, or you could misplace the eye bottle caps. So one thing you could do is use masking tape or labels and just put a label over a part of the eye drop bottle. And then you can just write something very simple on it with a marker, like capital R for right eye, capital L for left, or B for both. And then numbers like 1, 2, or 3 for how many times a day you have to take it. And the great thing is that you can then add a label just right over it every time it changes. And that way you're not relying on our list or keeping track of a list on a fridge. So moving on to these eye drop assist devices, I have no financial interest in these things that I'm going to discuss, but they do cost usually around $5. And everyone here, has probably different issues that they deal with, or maybe you're a perfect eye drop placer. But these devices might help you avoid wasting your eye drops and avoid you from running out of drops early. So one such device is the AccuDrop. Again, these are things that I found on Amazon, but I think a lot of them are also available at Walmart, and encourage you to look at your pharmacies as well. So this device, this blue cap, kind of goes over your eyes. You can see in the picture here. And there's a little notch so you can pull down your eyelid, and the bottle goes right through the center there, and it helps you aim towards your eye. There's another device called Easy Eye Drop, again, just around $5. And it's similar to the one that we saw before, but the one addition which I like is there's a bottle cap as well. So you can actually keep this on your bottle at all times if you'd like. And also it makes that bottle look very different from the others. Again, sometimes patients struggle with remembering which bottle to use how many times, and this is one good way to differentiate between your bottles. And there's another device called Auto Squeeze, which is really helpful if you're having trouble getting those drops out of the bottle, especially if you have arthritis or any issues with mobility. So this device should allow you to squeeze out a drop with less effort, and it gives you kind of more surface area to grip the bottle with. The same company makes something called AccuDrop, which is similar to the first devices I talked about, and it helps you aim the eye drop towards the eye. So that because it's the same company, you can actually use those two devices together, the Auto Squeeze and the AccuDrop, so that together they will help you aim better and also minimize the amount of effort it takes to squeeze out an eye drop. This other device is called Magic Touch. Now, I think this part gets a little tricky, so I want you to keep in mind that these devices are great, but if you feel like they're rough around your eye or that you're hurting your eye or coming too close to touching your eye, then it might just be better to go back to the way that you were putting in your drops before. But with this device, you put that blue cap over your index finger and you aim with the bottle and drop a drop into the well at the top of the device. And then you can just pull down your lower eyelid and gently almost touch the lower eyelid enough to displace the drop to your lower eyelid. And Simply Touch is very similar to the device I discussed before, just another version of it. And then one other thing is, we have these new medications that are coming, which is really exciting. But unfortunately, the cost of medications really is quite high. And we understand as providers that it can vary for each patient and your insurance. And everybody's situation is different. So, again, we encourage you to talk to us about the problems that you're facing with your medications and obtaining them. One website that really helps with this, I think, is called NeedyMeds.org. So it really helps you find kind of the various range of prices for eye drops. So I was surprised to know that the same medication can actually cost a different price in different pharmacies in the same town, irregardless of your insurance. And so if you type in the drug name that you're interested in, you have a variety of resources here. So you can look at patient assistance programs. You can look at whether there's a generic form available to you, and it's, again, very specific to your state, and which pharmacy might have this generic available for $4. There's also coupons and rebates that are available, and copay cards as well. And this is actually for all types of medications. So I know that you can be on many different medications, so it would be a great resource to just look up the medications that you're on every so often and make sure that you're paying a reasonable amount, as much as you can, for them. So again, in summary, we discussed a few different things. Hopefully, these are some things you might already know, but hopefully you learned something new as well. But again, I encourage you to download the Wills Glaucoma App. just to get some more power in your hands and really so you can keep track of your pressures, your medications, your allergies, and learn more about glaucoma. Again, I encourage you to wait 5 minutes between your eye drops and try that punctal occlusion that I described. And then if you think that you need it, try to look out for those devices to try to get your eye drops into your eye better and avoid wasting eye drops and running out of the drop earlier in the month. And again, if you want to look at the website, NeedyMeds.org, I think it's really great. And if anybody has any questions, I'd be happy to take them.